Question 1. A child screams loudly during transitions between activities. A functional analysis reveals that screaming occurs most often when the child is required to move from a preferred activity to a non-preferred activity and stops immediately when they are allowed to stay with the preferred activity. This suggests the screaming is maintained by A. Positive reinforcement, access to preferred activity. B. Negative reinforcement, escape from non-preferred activity. C. Automatic reinforcement, sensory input from screaming. D. Positive punishment, removal of demand. Answer: B. Negative reinforcement, escape from non-preferred activity. This question tests a tricky point about function, specifically distinguishing between getting something desirable and getting away from something undesirable. The clue is that the screaming happens when faced with a non-preferred activity and stops when they are allowed to stay with a preferred activity. This means the behavior successfully removes the unpleasant demand, transitioning to the non-preferred activity. Getting away from something unpleasant makes a behavior more likely in the future, which is the definition of negative reinforcement. Positive reinforcement would be about getting something added. Automatic reinforcement is internal. While staying with the preferred activity is a positive state, the screaming's direct effect is the removal of the unpleasant transition/non-preferred activity, making escape the primary function. Think, did the behavior get them away from something bad? Yes. Question 2. You are tracking a student's independent work completion. For the first 2 weeks, baseline, they completed an average of 3 problems per 10-minute period. You introduce a token system, intervention, and for the next 2 weeks, they complete an average of 8 problems per 10-minute period. To demonstrate experimental control, using a simple design, you then remove the token system for a week, and the work completion drops back to an average of 3 problems per 10-minute period. This sequence is characteristic of A. Multiple baseline design. B. Changing criterion design. C. Reversal design. A BA. D. Alternating treatments design. Answer: C. Reversal design, a BA. This question describes a classic single-subject experimental design. The pattern is baseline. A. Introduce intervention. B. Then remove the intervention and return to baseline conditions. A. Observing if the behavior changes reliably with the phase changes. The key clue is the remove the token system part, which signifies a return to the original conditions. This shows that the intervention, the token system, was likely causing the change in behavior. Multiple baseline introduces the intervention sequentially across targets. Changing criterion gradually changes the requirement. Alternating treatments rapidly switch between conditions. The going back to baseline is the hallmark of a reversal design. Question 3. A child often elopes, runs away, from the table during meals. The BCBA hypothesizes this is maintained by escape from eating non-preferred foods. During a functional analysis condition, the child is presented with a non-preferred food. If the child attempts to elope, the therapist immediately blocks the attempt and represents the food. In this specific functional analysis condition, the blocking and representation of food function as A. Positive reinforcement for elopement. B. Negative reinforcement for elopement. C. Punishment for elopement. D. Extinction for elopement. Answer: C. Punishment for elopement. This is a challenging question because it asks about the consequence within a specific test condition of a functional analysis. The child attempts to escape, elope, and the consequence is that they are prevented from escaping, blocking, and the unpleasant stimulus, non-preferred food, is added back or remains present. Representation of food. This consequence is designed to make elopement less likely to occur in this specific situation. Although it might increase other behaviors, preventing escape and keeping the unpleasant stimulus present are forms of punishment because they decrease the behavior's future likelihood in that context. Positive reinforcement adds something good to increase behavior. Negative reinforcement removes something bad to increase behavior, and extinction withholds the maintaining reinforcer. In this condition, the consequence is meant to make the escape behavior less effective, thus acting as punishment. Question 4. A behavior technician is instructed to reinforce a student for sitting in their seat instead of walking around the classroom. The technician gives the student a token every time they are sitting when they previously would have been walking. This is an example of reinforcing a behavior that cannot happen at the same time as the problem behavior. Which differential reinforcement procedure is this? A. DRA. Differential reinforcement of alternative behavior. B. DGRO. Differential reinforcement of other behavior. C. DGRI. Differential reinforcement of incompatible behavior. D. DDRL. Differential reinforcement of low rates. Answer: C. DDRI. Differential reinforcement of incompatible behavior. This question tests the specific nuances between differential reinforcement procedures. The key clue is reinforce a behavior that cannot happen at the same time as the problem behavior. Sitting in a seat is physically incompatible with walking around the classroom. You can't do both simultaneously. When you reinforce a behavior that physically prevents the problem behavior, it's called differential reinforcement of incompatible behavior, DRI. DRI reinforces a behavior that is an alternative but not necessarily incompatible, like asking for a break instead of screaming. You can do both, but one is better. DRO reinforces the absence of the behavior. DRL reinforces a lower rate. The physical impossibility is the giveaway for DRI. Question 5. When conducting a preference assessment, you present 2 items at a time and record which one the client chooses. You do this for every possible pair of items in your set. This is a description of A. Free operant assessment. B. Paired stimulus assessment, forced choice. C. Multiple stimulus without replacement, MSWO. D. Multiple stimulus with replacement, MSW. Answer: B. Paired stimulus assessment, forced choice. This question describes the procedure for a paired stimulus assessment, also known as a forced choice assessment. The key phrase is present 2 items at a time and record which one the client chooses, doing this for every possible pair. This method forces the client to choose between 2 items, and by presenting all pairs, you can create a hierarchy of preferences. A free operant assessment involves giving access to multiple items and seeing which ones they interact with and for how long. MSWO and MSW involve presenting multiple items, more than 2, in a lineup. Presenting items in pairs is specific to the paired stimulus method. Question 6. A child's biting behavior results in automatic reinforcement example sensory input. A BCBA implements a procedure where the child is given access to a vibrating toy to chew on whenever they attempt to bite themselves or others. This intervention is most likely an example of A. Punishment. B. Extinction. C. Non-contingent reinforcement, NCR. D. Differential reinforcement of alternative behavior, DRA. Answer: D. Differential reinforcement of alternative behavior, DRA. This question requires you to identify a specific procedure often used when the function of a behavior is known. The child bites, and the intervention is to reinforce a different behavior, chewing on the toy, that serves a similar sensory need, effectively providing an alternative way to get similar reinforcement. This is a classic example of differential reinforcement of alternative behavior, DRA. While it might reduce biting by providing the alternative, it's not pure extinction, which would involve preventing the sensory input from biting itself. If possible, it's not punishment, and while the toy might be offered non-contingently at times, the description links it to attempts at biting. Whenever they attempt to bite, suggesting reinforcement for the alternative behavior, you are reinforcing a different, appropriate behavior instead of the problem behavior. Question 7. You are tracking the total time a student spends out of their seat during a 60-minute observation. The student got out of their seat 5 times for durations of 2 minutes, 1 minute, 3 minutes, 30 seconds, and 1 minute, 30 seconds. What is the total duration you should record? A. 5 times. B. 15 minutes. C. 8 minutes. D. 60 minutes. Answer. C. 8 minutes. This question tests your ability to correctly calculate total duration from multiple occurrences. Duration is the total time a behavior occurs. You need to sum up the length of each instance of the behavior. The durations are 2 minutes, 1 minute, 3 minutes, 30 seconds, 0, 5 minutes, and 1 minute 30 seconds, 1, 5 minutes. Adding these up, 2 plus 1 plus 3 plus 0, 5 plus 1, 5 equals 8 minutes. Option A is frequency. Options B and D are incorrect sums, or the total observation time. Total duration is simply adding up how long the behavior lasted each time it happened. Question 8. A BCBA is teaching a complex skill, making a sandwich, using a task analysis. They decide to teach the last step first, providing prompts for all preceding steps, and reinforce the client for completing the final step independently. Once the client masters the last step, the BCBA teaches the second to last step, again providing prompts for all earlier steps and reinforces completion of the last 2 steps independently. This training method is called A. Total task presentation, B. Forward chaining, C. Backward chaining, D. Shaping. Answer C. Backward chaining. This question describes backward chaining. In backward chaining, you break the skill into steps using a task analysis. You teach the steps starting with the last step. The therapist completes or prompts the client through all steps except the last one, and the client learns to do the final step independently, which results in the natural reinforcer, the completed skill. Once the last step is mastered, you teach the second to last step, followed immediately by the already mastered last step, and so on, moving backward through the chain until the first step is reached, and the client can complete the entire sequence independently. Total task presentation teaches all steps at once. Forward chaining teaches the first step first. Shaping reinforces approximations of a single behavior, not a chain of steps. Teaching the last step first is the defining feature of backward chaining. Question 9. A stimulus that has acquired reinforcing properties through being paired with other reinforcers is called an A. Unconditioned reinforcer, B. Generalized unconditioned reinforcer, C. Unconditioned punisher, D. Conditioned reinforcer. Answer D. Conditioned reinforcer. This question asks about how stimuli become reinforcing. Some stimuli are naturally reinforcing, like food or water. These are unconditioned reinforcers. Other stimuli, like praise, stickers, or money, are not naturally reinforcing but become so because they have been consistently paired with other things that are reinforcing. These are called conditioned reinforcers because their reinforcing value was conditioned or learned through association. Unconditioned punishers are naturally aversive. Generalized conditioned reinforcers are a type of conditioned reinforcer that has been paired with many different backup reinforcers. The broad category for learned reinforcers is conditioned reinforcer. Question 10. A client engages in property destruction. The BCBA implements a procedure where, immediately following an instance of property destruction, the client is required to repair the damaged item and then perform an additional effortful task related to the damage example, cleaning the entire room. This is an example of a punishment procedure called A. Timeout, B. Response cost, C. Positive practice over correction, D. Restitutional over correction. Answer D. Restitutional over correction. This question describes a specific type of overcorrection, which is a positive punishment procedure. Overcorrection requires the individual to engage in effortful behavior contingent on the problem behavior. Restitutional overcorrection requires the individual to restore the environment to a state better than it was before the problem behavior occurred, repairing the damage and then doing additional cleaning. Positive practice overcorrection requires repeated performance of an alternative appropriate behavior. Timeout removes access to reinforcement. Response cost removes a reinforcer. The key here is restoring the environment beyond its original state, which is restitutional overcorrection, making it better than before the problem behavior. Question 11. You are teaching a child to identify colors. You show a red card and say red, reinforcing correct responses. You then show a blue card and say blue, reinforcing correct responses. After teaching red and blue separately, you start presenting both cards and ask touch red or touch blue, reinforcing correct choices and not reinforcing incorrect ones. This latter step involves A. Shaping, B. Generalization training, C. Discrimination training, D. Prompt fading. Answer C. Discrimination training. This question describes discrimination training. After teaching the individual responses to individual stimuli, teaching red with the red card only, blue with the blue card only, the next step is to teach the learner to respond differently when presented with multiple stimuli. Presenting both cards and reinforcing only the correct response to the named color teaches the child to discriminate between red and blue. Shaping reinforces approximations. Generalization training teaches the response to occur in new contexts or with new stimuli. Prompt fading reduces help. Teaching the learner to pick the correct item from a group is discrimination training. Question 12. According to the ethical code, before implementing any intervention that involves punishment, a behavior analyst must A. Obtain approval from the BCBA. B. First attempt to use reinforcement-based procedures. C. Only use it for behaviors maintained by automatic reinforcement. D. Ensure the client's family is comfortable with the procedure regardless of effectiveness. Answer B. First attempt to use reinforcement-based procedures. This question is about the ethical guidelines regarding punishment, the ethical code, and best practice in ABA. Mandates that punishment procedures should only be considered after less restrictive, reinforcement-based interventions have been attempted and found ineffective, or are deemed inappropriate for the severity of the behavior. Reinforcement-based methods are generally preferred because they are less intrusive and focus on building desired behaviors. You don't need BCBA approval for individual interventions. Punishment can be used for various functions, not just automatic reinforcement. Family comfort is important, but effectiveness and the hierarchy of restrictive procedures are primary ethical considerations. Always prioritize teaching and reinforcing appropriate behaviors first. Question 13. A BCBA is conducting a functional assessment. They hypothesize that a child's spitting behavior is maintained by attention. They decide to collect ABC data in the classroom. What would be the most important data to collect in the C column to support or refute this hypothesis? A. The amount of time the spitting lasts. B. How many times the spitting occurs. C. What the teacher or peers do immediately after the spitting. D. What activity the child was engaged in before spitting. Answer C. What the teacher or peers do immediately after the spitting. This question relates ABC data collection to hypothesizing function. If you think a behavior is maintained by attention, you need to see if attention consistently follows the behavior. The C in ABC stands for consequence, what happens immediately after the behavior. Recording what the teacher or peers do, example, look at the child, talk to them, scold them. Right after the spitting is crucial for determining if attention is serving as the consequence that maintains the behavior. Duration and frequency are measurements of the behavior itself. The activity before A is the antecedent. To test the attention hypothesis, you look at the immediate social consequence. Question 14. A graph that shows the rate of responding over time, with the slope of the line indicating the rate. Steeper slope equals higher rate, and never decreases is a A. Bar graph. B. Scatter plot. C. Cumulative record. D. Line graph. Answer C. Cumulative record. This question asks about a specific type of graph with unique characteristics. A cumulative record plots the total number of responses over time. Because it plots the cumulative total, the line can only move upward or stay flat if no behavior occurs, but never decrease. The rate of the behavior is visually represented by the slope of the line. A steeper slope means a higher rate of responding, while a flatter line indicates a lower rate. Bar graphs show comparisons. Scatter plots show variable relationships, while a cumulative record is a type of line graph. The specific description, cumulative responses, never decreasing line, slope shows rate, points specifically to the cumulative record. Question 15. A behavior technician is teaching a client to imitate clapping. When the technician says, "Copy me," and claps, the client does not clap. The technician then physically guides the client's hands to clap. Over several trials, the technician reduces the amount of physical guidance until the client claps with just the copy me and clap model. This process of reducing physical guidance is called A. Shaping. B. Prompt dependency. C. Stimulus fading. D. Prompt fading. Answer D. Prompt fading. This question describes prompt fading. A prompt is extra help to get the behavior to occur. In this case, the physical guidance is a physical prompt. Prompt fading is the systematic reduction of the prompt as the learner becomes more independent. You are gradually removing the physical help until the learner can perform the behavior, clapping, with just the model and instruction. Shaping reinforces approximations. Prompt dependency is when the learner only responds when the prompt is given. Stimulus fading changes the stimulus, not the prompt. Reducing the physical help is definitely prompt fading. Question 16. An event that occurs before a behavior and increases the current value of a reinforcer and makes behaviors that have led to that reinforcer more likely to occur is specifically called in A. Discriminative stimulus, SD. B. Conditioned stimulus, CS. C. Establishing operation, EO. D. Abolishing operation, AO. Answer C. Establishing operation, EO. This question asks about a specific type of motivating operation, MO. An MO changes the effectiveness of a reinforcer or punisher and influences behaviors that are related to that reinforcer or punisher. An establishing operation, EO, is a type of MO that increases the effectiveness of a reinforcer, makes you want it more, and increases the current frequency of behaviors that have been reinforced by that reinforcer in the past. For example, being hungry, EO, makes food more reinforcing and makes you more likely to seek food. An abolishing operation, AO, is the opposite, decreasing reinforcer value. SD is signal when reinforcement is available. CS is from classical conditioning. The dual effect on value and behavior likelihood before the response points to the EO. Question 17. A child learns to request car when they see a toy car. Later, they start saying car when they see a real car, a picture of a car, or a car in a book. This demonstrates A. Stimulus discrimination. B. Response generalization. C. Stimulus generalization. D. Response discrimination. Answer C. Stimulus generalization. This question describes stimulus generalization. The response, car, was trained in the presence of one stimulus, the toy car, but now occurs in the presence of other similar stimuli, real car, picture, car in a book, without specific training for each new stimulus. This is stimulus generalization. The learned response generalizes to new similar stimuli. Stimulus discrimination is responding differently to different stimuli. Response generalization is performing different responses that all produce the same outcome example, saying car, automobile, vehicle for the same car. Response discrimination is when a response is reinforced in some situations but not others. Responding similarly to different versions of the car stimulus is stimulus generalization. Question 18. The ethical principle that emphasizes avoiding harm to clients is A. Beneficence, do good. B. Non-maleficence, do no harm. C. Justice, be fair. D. Respecting autonomy. Answer: B. Non-maleficence, do no harm. This question asks about a key ethical principle. Non-maleficence is the principle of avoiding actions that would harm the client, while beneficence, doing good, is also crucial. Non-maleficence specifically focuses on the responsibility to prevent harm. Justice relates to fairness, and respecting autonomy relates to honoring the client's right to make choices. When you see questions about avoiding risky procedures, protecting safety, or not causing harm, think of the principle of non-maleficence. Question 19. You are recording data on head-hitting behavior. You decide to use a discontinuous measurement method where you check if head hitting is occurring only at the specific moment your timer beeps at the end of each 5-minute interval. What measurement method are you using? A. Partial interval recording. B. Whole interval recording. C. Momentary time sampling. D. Frequency recording. Answer: C. Momentary time sampling. This question describes momentary time sampling. The key clue is that you are recording the behavior only if it is happening at the exact moment the interval ends, at the specific moment your timer beeps. Partial interval records if it happened any time during the interval. Whole interval records if it happened throughout the entire interval. Frequency counts every instance. Checking the behavior only at the designated instant the interval concludes is the defining characteristic of momentary time sampling. Question 20. A potential disadvantage of using a reversal design. A BA is A. It requires multiple participants. B. It does not demonstrate a clear functional relation. C. It may not be ethical to remove an effective treatment if the behavior is dangerous. D. It cannot be used to evaluate the effects of punishment procedures. Answer: C. It may not be ethical to remove an effective treatment if the behavior is dangerous. This question asks about a limitation of the reversal design. While the ABA design is powerful for demonstrating a functional relation by showing behavior changes when the intervention is present and reverts to baseline when it's removed, it can be ethically problematic if the behavior you are decreasing is dangerous, like self-injury or aggression, or the behavior you are increasing is crucial, like eating. Removing an effective treatment for a dangerous behavior would mean putting the client at risk. The design can be used with one participant, it does demonstrate functional relations, and it can be used with various procedures, reinforcement or punishment. But the ethical concern about reversing beneficial treatment for severe behaviors is a significant disadvantage. Question 21. You are teaching a child to make a request using a picture card. You show the child a picture of a ball and say, "Ball." The child picks up the card. You physically guide their hand to give you the card and immediately give them a ball. Which component of the discrete trial training, DTT, trial are you providing when you physically guide their hand? A. Discriminative stimulus, SD. B. Response. C. Prompt. D. Consequence. Answer: C. Prompt. This question asks about the components of a discrete trial. The instruction ball is the SD. The child picking up the card is part of the response. Giving them the ball is the consequence, specifically reinforcement. The physical guidance you provide to help them complete the response, giving you the cardie, is a prompt. Prompts are extra helps provided before or during the response to make the correct response more likely. The physical guidance is assistance, making it a prompt. Question 22. The ethical principle of responsibility to clients includes A. Always following supervisor instructions without question. B. Prioritizing the needs of the agency over the client's needs. C. Acting in the best interests of the client and ensuring their safety and well-being. D. only providing services to clients who are easy to work with. Answer C. Acting in the best interests of the client and ensuring their safety and well-being. This question is about a broad ethical responsibility. The principle of responsibility to clients is fundamental and encompasses many actions, but at its core, it means prioritizing the client's welfare above all else. This includes making decisions based on their needs, ensuring their safety, and advocating for their well-being. Following instructions is usually good, but not without question if they conflict with ethics. Agency needs are secondary to the client's. You serve clients based on need and competence, not ease of work. Always put the client's best interests first. Question 23. A child engages in hand flapping. A functional assessment indicates this behavior is maintained by automatic reinforcement, sensory. An appropriate intervention might involve A. Providing attention immediately following hand flapping. B. Requiring the child to sit on their hands. C. Providing the child with access to preferred sensory toys non-contingently throughout the day. D. Taking away a token every time hand flapping occurs. Answer C. Providing the child with access to preferred sensory toys non-contingently throughout the day. This question asks about an intervention strategy often used for behaviors maintained by automatic reinforcement. When a behavior provides its own reinforcement, like sensory input from hand flapping, one strategy is to provide that same or similar sensory input without requiring the problem behavior. This is often done using non-contingent reinforcement, NCR, where the reinforcer, sensory toys, is provided on a time-based schedule, regardless of behavior. This decreases the motivation to engage in the problem behavior to get the sensory input. Providing attention, A, is for attention-maintained behavior. Sitting on hands, B, could be response blocking or incompatible behavior, but might not address the sensory need. Taking away tokens, D, is response cost, punishment. Providing alternative sensory input proactively is a common approach for automatic reinforcement. Question 24. You are training a new behavior technician on how to implement a differential reinforcement procedure. To ensure they are implementing it correctly, you watch them and record whether they delivered the reinforcer appropriately, example, only when the correct behavior occurred, not when the incorrect behavior occurred. This is a measure of A. Inter-observer agreement, IOA. B. Procedural fidelity, treatment integrity. C. Measurement accuracy. D. Social validity. Answer B. Procedural fidelity, treatment integrity. This question asks about ensuring that the intervention plan is being carried out correctly. Procedural fidelity, also known as treatment integrity, is the extent to which an intervention is implemented as planned. By watching the technician and checking if they follow the steps of the procedure, like correctly applying the differential reinforcement, you are measuring how accurately the procedure is being implemented. IOA is about whether two observers agree on the occurrence of the behavior. Measurement accuracy is about whether the data on the behavior is correct. Social validity is about acceptability. Ensuring the procedure is done right is procedural fidelity. Question 25. A stimulus that was previously neutral but has become a punisher because it was repeatedly paired with an unconditioned punisher is A. Unconditioned reinforcer. B. Conditioned punisher. C. Unconditioned punisher. D. Conditioned reinforcer. Answer B. Conditioned punisher. This question is about how stimuli become punishing. An unconditioned punisher is naturally aversive, like pain or extreme heat. A conditioned punisher is something that is not naturally aversive, but becomes punishing because it has been consistently paired with an unconditioned punisher or another conditioned punisher. For example, the word no isn't naturally aversive, but it becomes a conditioned punisher because it's often paired with losing a toy or receiving a reprimand. Unconditioned reinforcers and conditioned reinforcers increase behavior. If a previously neutral stimulus decreases behavior because it is paired with something bad, it's a conditioned punisher. Question 26. You are reviewing a client's graph of hitting behavior. You notice that during the baseline phase, the hitting occurred at a low, stable rate. When the intervention was introduced, the hitting immediately decreased to near zero and remained there. This pattern, where the behavior changes only when the intervention is applied, is an example of A. High variability, B. A trend, C. Experimental control, D. An extinction burst. Answer C. Experimental control. This question describes demonstrating experimental control. In single-subject designs, you show experimental control when the behavior reliably changes only when the intervention is introduced or removed. The clear pattern described, low baseline, then immediate and stable decrease with the intervention, strongly suggests that the intervention caused the change in hitting. High variability means the data points jump around a lot. A trend is a general direction, increasing or decreasing. An extinction burst is a temporary increase. Seeing the behavior change dependably with the intervention is how you prove that the intervention is effective and you have experimental control. Question 27. A type of reinforcement schedule where reinforcement is delivered for the first response that occurs after a fixed amount of time has passed is called A. Fixed ratio, FR, B. Variable ratio, VR, C. Fixed interval, FI, D. Variable interval, VI. Answer C. Fixed interval, FI. This question asks about a time-based reinforcement schedule that is predictable. In a fixed interval, FI, schedule, a set amount of time must pass before the first response can earn reinforcement. For example, an FI 5-minute schedule means the first response after 5 minutes has passed will be reinforced, and then the clock resets. This often leads to a pattern where responding is low right after reinforcement and increases towards the end of the interval. A scallop pattern, fixed ratio, FR, is based on a fixed number of responses. Variable ratio, VR, is based on a variable number of responses. Variable interval, VI, is based on a variable amount of time. The key is a fixed amount of time before the first response is reinforced. Question 28. A therapist is teaching a child to say thank you. When the child is given a toy, the therapist says thank you, verbal prompt. Over time, the therapist fades the prompt by whispering thank you, then mouthing it, and finally just using a nod. This is an example of A. Shaping, B. Stimulus fading, C. Prompt fading, D. Stimulus generalization. Answer C. Prompt fading. This question again describes prompt fading. The therapist is using a verbal prompt, thank you, to help the child say thank you. They are then gradually reducing the intensity of that prompt, whispering, mouthing, until the child responds without the verbal prompt. This systematic reduction of the prompt is prompt fading. Shaping reinforces approximations of the behavior. Stimulus fading changes the stimulus. Stimulus generalization is responding to similar stimuli. Reducing the help provided is prompt fading. Question 29. When selecting target behaviors for intervention, the most important consideration is A. How easy the behavior will be to measure. B. If the behavior is easiest for the staff to manage. C. If changing the behavior will be meaningful and beneficial to the client's life. Social validity. D. If the behavior is maintained by attention. Answer C. If changing the behavior will be meaningful and beneficial to the client's life. Social validity. This question is about the crucial concept of social validity in selecting target behaviors. While measurement ease and staff convenience are practical considerations, the most important ethical and effective practice is choosing behaviors that will have a significant positive impact on the client's life and are considered important by the client and those who care for them. This is the principle of social validity. The function of the behavior is important for choosing intervention strategies, but the initial choice of what behavior to target should be guided by what will improve the client's quality of life. Always ask, Will changing this behavior really matter for the person? Question 30. A child touches a hot stove and is burned. In the future, they are less likely to touch a hot stove. The burn is an example of A. Conditioned reinforcer. B. Unconditioned punisher. C. Conditioned punisher. D. Unconditioned reinforcer. Answer: B. Unconditioned punisher. This question asks about the type of consequence. A burn is naturally painful and aversive. You don't need to learn that it's bad. Stimuli that are naturally painful or unpleasant and decrease the behavior they follow are called unconditioned punishers. Conditioned punishers are learned to be aversive through pairing. Reinforcers increase behavior. Since the burn naturally decreases the behavior of touching the stove and its aversiveness is not learned, it's an unconditioned punisher. Pain, extreme temperatures, and strong tastes/smells are typical unconditioned punishers. Question 31. You are trying to increase a student's on-task behavior during independent work. You decide to reinforce the student with a sticker for every 5 minutes they remain on task. This is a fixed time-based schedule where the reinforcement is delivered after 5 minutes if the target behavior, on task, was occurring. This sounds like a variation of A. Fixed interval, FI. B. Variable interval, VI. C. Fixed ratio, FR. D. Variable ratio, VR. Answer: A. Fixed interval, FI. This question describes a schedule that is based on a fixed amount of time, 5 minutes, and delivering reinforcement after that time, contingent on the target behavior occurring. Being on task, this most closely aligns with a fixed interval, FI, schedule, although it has a response requirement, being on task, within or at the end of the interval. Standard FI reinforces the first response after the interval. However, structured interval reinforcement procedures, like this in applied settings, are derived from interval schedules. Fixed ratio, FR, and variable ratio, VR, are based on the number of responses. Variable interval, VI, is based on variable time. The fixed 5-minute period is the key interval clue. Question 32. The ethical principle of justice relates to A. Being honest and truthful in all professional interactions. B. Avoiding conflict of interest and professional boundaries. C. Advocating for fair and equitable access to services for all clients. D. Using only the least restrictive procedures possible. Answer: C. Advocating for fair and equitable access to services for all clients. This question asks about the ethical principle of justice. In ethics, justice refers to fairness, equity, and impartiality. For behavior analysts, this means advocating for fair access to effective services for all individuals who need them, regardless of their background, diagnosis, or ability to pay. It's about ensuring everyone gets a fair shot at benefiting from ABA. Honesty is integrity. Avoiding conflict is part of various principles like integrity and professionalism. Using least restrictive procedures relates to beneficence and responsibility to clients. Justice is about fairness and equity in service provision. Question 33. You are conducting a functional analysis of a child's aggression. In the alone condition, the child is in a room with toys but no interaction, and any aggression is ignored. The purpose of this condition is typically to test for which function? A. Attention. B. Escape. C. Access to tangibles. D. Automatic reinforcement. Answer: D. Automatic reinforcement. This question asks about interpreting a specific condition in a functional analysis. The alone condition removes social consequences, attention from others, and access to external tangible items contingent on the behavior. If the aggression persists or occurs at a high rate in this condition, it suggests that the behavior is not being maintained by social attention, escape from demands, as there are none, or access to external items. It points towards the behavior being maintained by something inherent to the behavior itself, like a sensory feeling or physiological change, which is automatic reinforcement. This condition isolates automatic reinforcement by minimizing other potential maintaining consequences. Question 34. When preparing for a session, you gather all the necessary materials, toys, data sheets, reinforcers, visual aids, and organize the environment to reduce distractions. These steps taken before the session begins are considered: A. Consequence strategies. B. Measurement procedures. C. Antecedent interventions. D. Reinforcement schedules. Answer: C. Antecedent interventions. This question is about strategies that are implemented before the behavior occurs. Gathering materials and setting up the environment are actions taken to set the stage for successful learning and reduce potential problems before the session starts. These are examples of antecedent interventions because they modify the environment or context prior to the behavior. Consequence strategies happen after the behavior. Measurement procedures are how data is collected. Reinforcement schedules determine when reinforcement is delivered. Preparing the environment beforehand is all about influencing behavior by managing what happens before they even start working. Question 35. Which type of reinforcement schedule produces a high, steady rate of responding with very little pausing after reinforcement? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FAVI. D. Variable interval, VI. Answer: B. Variable ratio, VR. This question asks about the typical pattern of responding produced by different reinforcement schedules. Variable ratio, VR, schedules where reinforcement is delivered after an unpredictable average number of responses are known for producing high and consistent rates of responding with very little pausing after reinforcement. Because the next response might be reinforced, the individual is motivated to keep responding at a high rate. Fixed ratio, FR, schedules also produce high rates but often have a noticeable pause right after reinforcement is delivered. Fixed interval, FI, produces a scallop pattern with increased responding towards the end of the interval. Variable interval, VI, produces a steady, moderate rate of responding. The high, steady rate with minimal pausing is characteristic of VR.